Hi, I'm Dr. Daniel Chen. I've spent years treating patients in cardiology and internal medicine, and there's one case I still think about often. It's the case of a patient I'll call James. He was 75 years old, active for his age. He walked his dog every morning. He gardened on weekends. He didn't smoke. His blood pressure was under control. On paper, James looked like a healthy senior. But one week, everything changed. James came into my office complaining of two things: arm pain and fatigue. Not chest pain, not the crushing pressure you see in movies, just a dull ache in his left arm and a tiredness that wouldn't go away. He told me he thought he'd slept on his arm wrong. He thought the fatigue was just getting older. Many seniors think this way. It's a dangerous assumption. I ran some basic tests that day. Nothing seemed urgent at first glance. I told him to rest and come back if things got worse. 3 days later, he came back. This time, we ran a blood test, a test that checks for cardiac enzymes, specifically something called troponin. The results were shocking. James had already had a heart attack. Not that day, days earlier. His heart muscle had been damaged, and he never felt classic chest pain, no crushing sensation, no pain radiating down his arm and jaw together, just fatigue and a dull ache. This is called a silent heart attack, and it is far more common in seniors than most people realize. Let's talk about why this happens. Why do older adults often miss the warning signs? First, aging changes how the body senses pain. Nerve sensitivity decreases with age. This means the classic chest pain response can be dulled or completely absent. Second, many seniors have other health conditions. Diabetes is one of the biggest factors. Diabetes can damage nerves over time. This is called diabetic neuropathy. It can reduce the ability to feel pain from a heart attack. This makes silent heart attacks especially common in diabetic seniors. Third, seniors often have multiple aches and pains already: arthritis, old injuries, general fatigue from other conditions. This makes it easy to dismiss new symptoms as just another ache or just getting older. Fourth, women and older adults in general present differently than younger men. The textbook heart attack symptoms were largely studied in middle-aged men. Fatigue, nausea, and shortness of breath are just as important, sometimes more important than chest pain itself. Now let's talk numbers. Studies suggest that up to 45% of heart attacks may be silent, meaning the person didn't experience obvious chest pain. Silent heart attacks are especially common in adults over 65, and even more common in adults with diabetes. This is why I want you to remember something important. A heart attack does not always look like the movies. There is no rule that says it must involve crushing chest pain. So what should you watch for instead? Let's go through the real warning signs, especially the ones seniors often overlook. Number 1, unusual fatigue. Not just being tired after a long day, but a heavy, unexplained exhaustion. Fatigue that comes on suddenly or that doesn't improve with rest. Number 2, shortness of breath, feeling winded during normal activities. Activities that never used to cause breathlessness, like climbing a few stairs or walking to the mailbox. Number 3, pain or discomfort in the arms, especially the left arm, but it can also affect the right arm or both. Number 4, jaw, neck, or back pain. This can feel like a dull ache, not always sharp or severe. Number 5, nausea or indigestion-like symptoms. Many seniors mistake this for a stomach issue or something they ate. Number 6, sudden dizziness or lightheadedness, especially without an obvious cause. Number 7, cold sweats, breaking into a sweat without physical exertion or without a fever. Number 8, a general sense that something is wrong. This one is harder to explain, but many patients describe it after the fact. A quiet internal signal that something wasn't right. James experienced two of these signs, arm pain and fatigue. That was enough to warrant a blood test, and that blood test likely saved his life. Now, let's talk about what happens after a silent heart attack is caught.
Once we confirmed James had suffered a heart attack, we moved quickly. We ran additional imaging, an echocardiogram to look at his heart function. We also performed a cardiac catheterization. This allowed us to see his coronary arteries directly. James had a blockage that needed intervention. He received a stent to open the blocked artery. He was started on medications, blood thinners, cholesterol-lowering medication, and medication to protect his heart muscle going forward. James recovered well, but he was lucky. Silent heart attacks that go undetected can lead to serious complications, including heart failure, or a second, more severe heart attack, sometimes without warning. This is why early detection matters so much. So what can you do starting today? First, don't wait for classic chest pain to seek care. If something feels different in your body, get it checked. Fatigue that doesn't make sense, arm discomfort that lingers, shortness of breath during normal activities, these deserve attention. Second, if you're over 65 or have diabetes, talk to your doctor. Ask about your personal risk for silent heart attacks. Ask whether periodic screening makes sense for you. Third, know your numbers, blood pressure, cholesterol, blood sugar levels. These numbers tell a story about your heart health. Fourth, don't dismiss new symptoms as just aging. Aging does bring aches and changes, but sudden or unusual symptoms deserve a second look, not automatic dismissal. Fifth, if you have family members over 65, talk to them about this. Many seniors don't want to bother a doctor. They don't want to seem dramatic. Gently remind them that catching a problem early is never a bother. It could be life-saving. I want to leave you with this thought. James is doing well today. He still walks his dog every morning. He still gardens on the weekends. But his story could have ended very differently. A heart attack doesn't always announce itself loudly. Sometimes it whispers, a little fatigue, a little arm discomfort, nothing dramatic, but your body is always trying to tell you something. The key is learning to listen. If you found this helpful, please talk to the seniors in your life about this. Share this information with a parent, a grandparent, a neighbor. It could make all the difference. I'm Dr. Daniel Chen. Take care of your heart and take care of each other. This video is for general educational purposes only. It is not a substitute for professional medical advice. If you're experiencing symptoms, please consult a licensed physician or seek emergency care if symptoms are severe.